Welcome, everyone. We're starting our emergency drug series, a journey to learn about powerful medicines that can save lives. In this first lecture, we'll be talking about adrenaline, one of the most important drugs in clinical practice, especially for its life-saving role in emergencies. Let's start the video. First of all, we talk about its introduction. Adrenaline, also called epinephrine, is known as your body's emergency chemical because it's released when you face stress, danger, excitement, or strong emotions. It works in two main ways in your body, as a neurotransmitter and as a hormone. As a neurotransmitter, adrenaline is released from nerve endings in your nervous system. As a hormone, it's released from the adrenal glands which sit on top of your kidneys. Now, let's see how adrenaline works in the body, its mechanism of action. Adrenaline belongs to a class of drugs called sympathomimetics. It works by stimulating adrenergic receptors. These are the sites in the body where adrenaline binds to produce its effects. There are two main types of adrenergic receptors all over the body where adrenaline binds: alpha and beta receptors. Alpha receptors are further divided into alpha 1 and alpha 2. Beta receptors are further divided into beta 1, beta 2, and beta 3. These receptors are divided into types based on their location in the body. Let's see what happens in the body when adrenaline is released. We understand it step by step. Step 1. A danger or stress signal. This happens when you see or experience something that triggers fear or stress. For example, a barking dog running toward you. Your brain, through the hypothalamus, senses the threat. And then brain, via the hypothalamus, instantly activates the sympathetic nervous system. When your sympathetic nervous system activates, adrenaline is released from nerve endings as a neurotransmitter. And at the same time, your adrenal medulla releases adrenaline into the bloodstream as a hormone. In step 2, binding to receptors. In this step, adrenaline travels through the body, binds to alpha and beta receptors in different organs, and triggers various effects. Once adrenaline attaches to different adrenergic receptors in various organs. Let's see what happens when it binds to each type of receptor. Alpha 1 receptors are located in certain blood vessels. When adrenaline binds to them, the blood vessels constrict, which helps maintain or raise blood pressure. Alpha 2 receptors are mainly found in nerve endings. When adrenaline binds to them, they act as a feedback system, reducing further release of adrenaline and noradrenaline. That's how alpha receptors work. Now let's see how beta receptors affect the heart, lungs, muscles, and fat. Beta 1 receptors are found in the heart. When adrenaline binds to them, it makes the heart beat faster and pump with more force. Beta 2 receptors are in the lungs and skeletal muscles. When adrenaline binds to them, it relaxes the airways and increases blood flow to the muscles. Beta 3 receptors are found in fat tissue. When adrenaline binds to them, it stimulates the breakdown of fat to release energy. All these receptor actions work together to prepare your body for an emergency. As a result, you're fully ready for the fight or flight response, with a faster heartbeat, stronger muscle power, wider airways, and more available energy. Now that we understand how adrenaline works at the receptor level, let's learn about its clinical uses, routes of administration, and dosage, and see how this life-saving drug is applied in real emergencies. Let's start with one of the most critical emergencies, anaphylaxis. What is anaphylaxis? Anaphylaxis is a sudden and severe allergic reaction that can occur after exposure to triggers like insect stings, certain foods, or medications. It can cause swelling of the airway, making it difficult to breathe, a rapid drop in blood pressure, skin rashes, itching, and sometimes even loss of consciousness. Now, why adrenaline is used. Adrenaline is the first-line treatment for anaphylaxis because it works quickly to reverse these dangerous changes. It relaxes the airway muscles to open breathing passages, constricts blood vessels to raise blood pressure, reduces swelling in the throat to prevent airway blockage, and stops the release of more allergic chemicals from immune cells. Route of administration. In anaphylaxis, adrenaline is usually given as an intramuscular injection into the outer thigh, because this allows the drug to be absorbed quickly and act rapidly to save the patient's life. Now, the recommended dose of adrenaline for anaphylaxis. The typical dose is 0.3 to 0.5 milligrams intramuscularly. If symptoms persist, it can be repeated every 5 to 15 minutes. Another important use of adrenaline in emergencies is cardiac arrest. It is a life-threatening condition where the heart suddenly stops pumping blood effectively. The patient collapses, loses consciousness, and without blood flow, vital organs like the brain can be damaged within minutes. Now, why adrenaline is used? In cardiac arrest, adrenaline is given to stimulate the heart through beta-1 receptors, making it beat stronger and faster, and to constrict blood vessels through alpha receptors, pushing blood toward the brain and heart. This increases the chances of restarting circulation. Now, let's look at the routes of adrenaline administration. In cardiac arrest, adrenaline is usually given directly into a vein for the fastest effect. If a vein can't be accessed quickly, it can also be injected directly into the bone marrow. Next, the recommended dose of adrenaline. The recommended dose of adrenaline in cardiac arrest is 1 milligram intravenously every 3 to 5 minutes. The next clinical use of adrenaline in emergencies is asthma. Adrenaline is not the first choice for treating severe asthma. However, in an emergency when other asthma medications fail, adrenaline can be used to quickly open the airways. In severe asthma, the airways become very narrow because the muscles around them tighten and the lining becomes inflamed. This makes breathing extremely difficult and can be life-threatening if not treated quickly. Now, why adrenaline is used? Adrenaline works by stimulating beta-2 receptors in the airway muscles, causing them to relax. This quickly opens the airways, making it easier to breathe. It's especially useful in emergencies when standard asthma medications, like inhaled bronchodilators, aren't effective enough. Let's discuss its routes. In severe asthma, adrenaline can be given as an intramuscular injection for rapid absorption during emergencies. Sometimes it's also delivered through a nebulizer, which sends the medicine directly into the lungs for quick relief. The IM route is preferred when inhalers or nebulizers alone aren't enough to open the airways. Now, let's see the recommended dose of adrenaline for severe asthma. The typical dose of adrenaline in severe asthma is 0.3 milligrams given as an intramuscular injection. In some cases, it can also be administered via nebulizer, following clinical guidelines. This ensures the medicine works quickly to open the airways and make breathing easier during an emergency. Next clinical use of adrenaline in emergency is shock. Shock is a life-threatening emergency where the blood pressure drops so low that the body's organs don't get enough oxygen and nutrients. It can happen due to different causes, for example, severe infections known as septic shock, heart failure called cardiogenic shock, major blood loss known as hypovolemic shock, or even a severe allergic reaction called anaphylactic shock. Some important points about adrenaline in shock. Adrenaline is the first-choice drug in anaphylactic shock and should be given immediately as an intramuscular injection. For other types of shock, like septic, cardiogenic, or hypovolemic, the first-line treatment is usually noradrenaline or other vasopressors. However, adrenaline can still be used as a carefully controlled infusion in intensive care, especially in severe or resistant cases. It's important to note that adrenaline is generally not used for airway swelling caused by shock itself, unless there's an allergic component, like in anaphylaxis. Now that we know when adrenaline is used in shock, let's look at routes of administration. For shocks such as septic, cardiogenic, or hypovolemic, adrenaline is usually given as a slow intravenous infusion in the ICU. Dose in shock. In shock, adrenaline doesn't have a fixed dose. The amount is carefully adjusted based on the patient's blood pressure and response. We've covered adrenaline in emergencies, its introduction, mechanism, uses, doses, and routes. If you found this video helpful, don't forget to like, share, and subscribe to the channel for more medical learning.